morning, everyone! Ito po ang Doctors on TV, tagapaghatid ng impormasyong pangkalusugan. And I'm your host, Dr. Barba-Cabodil. I'm always grateful to God for giving me the opportunity to provide you with information that nourishes your mind with wellness. Moving forward, mga kasambahay, dakaw na tayo sa ating pag-uusapan ngayong araw. Ito po ay ang retinal detachment. Naku, at bago ko po tawagin ang ating panauhin ngayong umaga, panoorin muna natin ang paunang detalye.
Ang ating mga mata ay napakahalaga, lalo na't ito ay ating nagagamit sa araw-araw na ating pagkilos. Ngunit ang mga sakit sa mata ay madalas na napag-uusapan dahil habang tayo ay tumatanda, isang ating mga mata sa pinaka naaapektuhan. Sa katunayan, naitala ng World Health Organization na sa halos 1 bilyon na mga tao sa buong mundo ay may vision impairment na sana ay naagapan ng maaga kung ang lahat ay may kamalayan ukol sa early o timely detection. Isa na rito ang retinal detachments na kilala na seryosong kondisyon sa mata na pagka napabayaan ay maaaring hindi na makakita ng tuluyan. Kaya mga kasangbahay, gaano kahalaga ang pagkakaroon ng awareness ukol sa mga sakit sa mata? Para sa kasagutan, ipagpapatuloy yan ng ating panauhin ngayong umaga.
At para mas maliwanagan pa tayo sa mga impormasyon ukol sa retinal detachment, ipapakilala ko na po sa inyong ating panauhin. He has the commitment to precision and utmost care, specialized in diagnosing and treating a wide range of eye conditions, ensuring optimal vision and eye health for every patient. Let us welcome Dr. Sherman Valero, an ophthalmologist from Makati Medical Center. Good morning, Dr. Sherman, and welcome back to Doctors on TV.
Good morning. It's nice to be back.
Yeah, I'm very happy to see you again. Suki
na.
Yes, I know. And I'm sure natutuwa yung ating mga viewers na suki na very interested talaga when it comes to topics about eye problems. Okay. Ito at syempre, Doc Sherman, I want to ask you first, gaya po ng tanong kanina, no? Kung gaano ba kahalaga ang pagkakaroon ng awareness ukol sa mga sakit sa mata. Very basic but very important.
Well, kailangan talaga nating alagaan ng mata natin kasi as you all know, gamit talaga natin to sa pang daily lives natin. No? In fact, studies have shown na mas mataas ang rate ng depression sa mga lumalabo ang mata kaysa sa may cancer. Those who have poor vision actually are more depressed than those who have cancer. So, very important siya sa ating daily living. No? Kasi imagine mo, pag lumabo ang mata mo, wala ka talagang magagawa. Kabuhayan mo, your social life, your personal life, they will all suffer. So, kailangan talaga alagaan natin.
Oh, that's very significant to know. Kaya alagaan talaga natin. And since we'll be talking about retinal detachment, siguro we might as well baka pwede natin silang bigyan ng basic info about retina. Ano ba ang retina?
Well, retina basically is the inner lining of the eye. No? Yung kung ang mata natin parang basketball, hatiin mo yung basketball, yung nasa loob niya, yun yung pinaka-retina. Kumbaga sa camera, yun yung film ng camera natin. No? So, that's the light-sensitive material that allows us to see. No? Kailangan yun nakadikit sa likod ng mata para makakita tayo.
I see. And if we talk about detachment, okay, retinal detachment, ano yung pinaka-magiging problema dito?
Okay, so ang nangyayari nga, yung nakadikit ng retina sa likod ng mata mo, humihiwalay siya o napipigtas siya or napupunit at humihiwalay dun sa likod mo. Kaya tawag dun detachment. Kumbaga, yung wallpaper sa dingding mo na pupunit, no, or humihiwalay.
How does it happen? Bakit? Ano yung mga nangyayari? May mga malpractices ba? May mga maling ginagawa ang mga individuals? Kumbaga kaya nagkakaroon ng retinal detachment?
Maraming causes ang retinal detachment. The most common cause of retinal detachment is yung tinatawag na rhegmatogenous o nabubutas o napupunit ang retina. This is basically ang mga risk factors nito dahil masyadong mataas ang grado natin, very severely myopic. Pag severely myopic kasi, yung mataas ang grado at very nearsighted, yung retina mo manipis at madaling mapunit. No? So, pag napunit siya, maaaring pumasok yung tubig sa ilalim ng retina at matuklap yung retina natin.
I see. How about trauma to the eye?
Trauma is also a cause, no? Trauma. And then there are other types of detachment na tinatawag ng tractional detachment. Nagkakapeklat yung mata, hinihila yung retina. That happens in cases naman of diabetes, no? So that's a totally parang different mechanism of retinal detachment.
I see. But I mean, can you consider yung iba kasi nagtatanong yung iba kung kunyari pagka balaging may habit sila na nagkakamot ng mata palagi. Yung iba kasi gigil na gigil talaga. Can this
Hindi
traumatic?
naman. It's not that ang trauma na to create a retinal detachment has to be a very strong blunt trauma. No, malakas na trauma.
Na-impact talaga.
Na-impact.
For it to happen.
That yung rubbing will have other issues. No?
Iba
Magkakaibang
naman.
problem.
I see. Okay. And are there different types of retinal detachment?
Yun nga, the most common cause is called regmatogenous retinal detachment. Regma means may butas.
May butas lang.
So regmatogenous retinal detachment, that's what we usually see, no? Nabubutas yung retina, napupunit yung retina at pumapasok yung tubig. The other one is traction retinal detachment. Nagkakapeklat yung on top of the retina at hinihila niya, no? That happens in mga diabetic retinopathy, no? And then meron pa yung iba yung exudative retinal detachment na nanggagaling sa ilalim ng mata yung tubig in cases of inflammation, infection, mga ganon. But the most common that we see is yung regmatogenous retinal detachment.
I see. And usually sa mga cases ng retinal detachment na nakita nyo, Doc, no? How young yung youngest patient na pwede magkaroon?
It spans a range of ages, no? My youngest retinal detachment patient na regmatogenous was probably 10, 9, no? Meron, but mostly young individuals, no, 20s, 30s. It also happens in older individuals. So walang pinipili yan. Ang risk factor niya usually is family history of retinal detachment, mataas ang grado, no? So yung mga mataas ang grado, kailangan natitingnan talaga sila, no?
I see. And eto ba, Doc, meron tong genetic predilection?
Yes. So, kasi nga, one of the risk factors is nearsightedness, and nearsightedness is really
so, indirectly,
genetic.
meron genetic.
Tapos, pag may history ka talaga ng retinal detachment, parang mas tumataas yung risk mo of retinal detachment.
I see. And, Doc, usually yung mga nakikita niyong pasyente, pag dumating sa inyo, kalimitan yung common cause na na-encounter nyo, bakit nagkaroon ng retinal detachment?
It's usually what we call idiopathic, no? Nangyayari lang talaga siya.
Unknown, ibig sabihin hindi alam, just happen.
Well, talaga, kasi as we get older, may jelly tayo sa loob ng mata. So yung cavity ng mata natin, meron talagang jelly sa loob ng mata. As we go older, natutunaw yung jelly na yun. As it melts, minsan hinihila niya yung retina. So napupunit yung retina. Kadalasan walang nangyayari, but in some people, pag melt yun yung nakikita mong floaters minsan.
Yeah.
No? That's actually the melting of your jelly inside the eye. Most of the time, walang complication yun. But sometimes, especially kung manipis ang retina mo, pag natunaw yung jelly na yun, nahihila niya yung retina at napupunit.
I see. So, mas maganda dapat talaga intact lagi yung jelly.
Well, hindi natin mapipigilan talaga. As we get older, talaga matutunaw at matutunaw. It's really part of aging. 99%,
That's inevitable talaga.
99% of the time, walang problema.
So, sa siyensa, wala pang nailalagay para just so it can delay the
Wala.
Okay. And what are the usual risk factors dito na lang?
Yun nga, nearsightedness. No? Nearsightedness is the main risk factor. Family history of retinal detachment. Trauma, as you've said. No? And yung ibang klaseng mga retinal detachment, yung tractional nga, diabetes is also a primary cause.
I see. And usually, pag pumunta sa inyo yung pasyente, no, kalimitan, ano yung common complaint na parang that will give you a sign na kung mukhang retinal detachment?
Okay, usually, ang nagsisimula ang simptomas na to, yung mga patients mag-complain of, may nakikita akong floaters, biglang may nakikita akong mga umiitim-itim na lumulutang or may kumikislap-kislap na ilaw. That means that the jelly inside the eye is melting at humihila dun sa retina. Kapag na-detach na yung retina mo, ang nangyayari niyan, dumidilim yung part na nade-detach. So, may nakikita silang parang cortina na nakaharang sa vision nila. So, that means nagde-detach na yun.
I see. And are these floaters specific for retinal detachment?
Not necessarily, no. It can be caused by other things, but it usually is associated with yun yung mga madalas na sintomas.
Okay, so is retinal detachment an emergency?
Yes, it is one of the emergencies sa mata na kailangan mo siyang ayusin kaagad.
How serious is it?
It's potentially blinding. Kapag hindi mo siya naayos, pag na-detach na lahat ng retina mo, hindi na makakakita. Yun, kasi yun yung film ng camera mo hindi na nagpo-function. So, ang namin, habang maliit pa yung detachment, ayusin na natin kaagad. No? Kasi pag na-involve na yung gitna ng vision mo, pumapangit na yung chances mo. So, as soon as you see it, kailangan magpatingin na kayo. No? So, especially kung yung curtain na nakikita niya, maaring galing sa taas, sa baba, sa side. No? Sometimes, they'll see parang madilim dito, tapos lumalaki na lumalaki. Ibig sabihin, nagpo-progress yung retinal.
Okay, so pag retinal detachment, pwede pa siyang ma-repair.
Yes, yes.
But once it has progressed to blindness already, so that's irreversible.
The longer na, the poorer your vision is, and the longer you've had the retinal detachment, kahit i-repair mo siya, hindi na rin bumabalik 100%. No? So, the earlier you repair it, the better.
So basically talaga, again, this will boil down to early diagnosis pa rin and early management.
Yes,
Okay.
kailangan lang patients are aware na there is something wrong na parang hindi siya nawawala, hindi nawawala yung symptom na yun, magpatingin na sila sa doktor.
Okay. And I mean, ano pa yung ibang parang mga practices ng mga individuals which can contribute to having like retinal detachment? Can stress be one or not really?
No, hindi natin pwedeng i-blame ang stress dito. No, it's just really the way your eye was built. No, unfortunately, short of trauma talaga, wala naman masyadong nagko-cause ng yung tinatawag na rheumatogenic retinal detachment. It is the anatomy of the eye.
So basically, may anatomical defect lang over time.
Well, yeah, parang anatomical predisposition, parang malas mo na lang.
So
talaga.
this time around, si stress hindi mo siya pwedeng
Hindi mo
i-blame.
pwedeng
Kasi lagi na lang yung
palagi na
stress.
si stress. Ito, hindi mo pwedeng sisihin
Wawa
si stress.
naman,
So,
yeah. Okay,
sometimes lang, pag stress sila, hindi nila pinapansin yung symptoms.
Yeah.
So, tumatagal.
Na-overlook. That's when stress become contributing factor.
Correct.
Okay. Kasi nagkakaroon ng delay sa management.
Correct.
Yeah, okay. Pero hindi talaga. Okay. Anyways, ito mga kasambahay. Okay, mas maganda ito nagiging takbo ng ating usapan. And marami po tayong matututunan about retinal detachment. Of course, with Dr. Valerio pa rin. So mga kasambahay, dyan lamang kayo at magbabalik pa rin ng Doctors on TV. Welcome back mga kasambahay! Naku, at bago po tayo magpatuloy sa ating talakayan, we'd like to invite you to follow and subscribe to our social media accounts. Please like and follow our Facebook page at www.facebook.com/doctorsontv and like and subscribe to our YouTube channel. Just type www.youtube.com/UNTV News and Rescue. Naku, maaari niyo pong balik-balikan mga kasambahay ang mga episodes ng Doctors on TV sa aming pong Facebook page at YouTube channel. Naku, kaya after liking and subscribing, pakishare nyo na din po sa inyong mga friends and family. Naku, dahil napakahalaga po ng pagkakaroon ng awareness, lalo na't ito'y tungkol sa ating kalusugan. At ngayon naman po ay pag-uusapan natin ang mga diagnostic measures and treatment options para sa retinal detachment. At syempre kasama pa rin natin si Dr. Sherman Valero, an ophthalmologist from Makati Medical Center. Eto, Doc, na bago tayo pumunta sa diagnostic procedures, okay? So, Doc, I would want to ask, so gaano ba yung progression ng retinal detachment?
Well, sometimes mabilis talaga ang progression ng retinal detachment, especially if it's yung may butas na retinal detachment, yung rheumatogenic retinal detachment. In a span of days, pwedeng ma-total detachment yung mata mo. So, kailangan talagang patingnan kaagad.
I see. And usually, how do you go about the diagnosis? Ano yung mga ginagawa? May mga nire-request ba or diretso sa clinic nyo?
Usually, na-diagnose namin yan with clinical examination. What we do is we dilate the pupils. May pinapata kami sa mata. Usually, yan dadating yung patient, may complaints na, may parang nakaharang sa mata ko. So, sisilipin namin, titingnan namin yung vision, tapos we'll put some dilating drops para mag-dilate yung pupils, para makita namin yung loob ng mata. And usually, that is sufficient for us to diagnose retinal detachment.
I see. And what would be your first line of treatment pag nakita yung retinal detachment?
Okay, so may iba-ibang klaseng management ng retinal detachment. No? Anywhere from nag-i-inject lang kami ng hangin sa loob ng mata to push the retina back and then i-laser namin siya. Or naglalagay kami ng parang sintron sa paligid ng mata para to
lock that in.
And then, or we go inside the eye, clean the jelly, and then drain the fluid, and then laser, and then put in air or something to push the retina back in.
Okay, are these procedures that you just mentioned surgical? Or
Surgical, they're all surgical.
they're all surgical. And usually, how long does the procedure last?
Okay, depends on the procedure. Yung pag-inject ng hangin, mabilis lang yun. That's the simplest. No? We call it pneumatic retinopexy. Yung scleral buckle and yung vitrectomy. With the buckle is when you put the belt around the eye. No? And then vitrectomy is when we go inside the eye to take out the vitreous jelly. They will probably run anywhere from an hour to 2 hours. Depende kung gaano kahirap yung surgery.
Or depending on the stage also
Depending
of
on
the
the stage
retinal
also.
detachment. I see. And
depending kung papatulugin din yung pasyente o hindi. No?
Okay, so it's not always tulog the pasyente.
It's not always you can do it under local now because of the improved equipment and instrumentation. A lot of these cases can be done under local anesthesia.
I see. And what would be the expectations of patients once they have undergone this surgical procedure?
Okay, for the most part, nag-i-inject kami talaga ng hangin sa loob ng mata. Nag-iiwan kami ng hangin sa loob ng mata. It's a special kind of air that lasts for a few weeks. No? Para yan tinutulak yung retina na natuklap. And while the air is there, wala kang masyadong makikita. So, medyo few weeks kang malabo until mawala yung hangin. Ina-absorb ng katawan natin yung hangin sa loob ng mata. And while the air is still there, may nakikita kang itim doon. So
that's really uncomfortable for the patient for a
yes,
while.
For a
but of
while,
course, we're speaking here ng for long term.
Yes,
mas maganda yung at least yung outcome right after the, I mean, once the improvement from the surgery has started to be appreciated. Pero Doc, ito, I forgot to ask, yung parang bilateral ba lagi yung retinal detachment or does it come in one?
Hindi naman napakamalas mo naman kung bilateral, but I've had cases na bilateral in different stages. But if you have a risk for kung nangyari yung retinal detachment in one eye, that means your other eye is also at risk. So mas binabantayan natin.
I see. The reason why I asked kasi di ba you mentioned that for a while, while habang for a few weeks na naglagay kayo ng special air. So medyo talagang blurred ang vision.
Kung nangyari sa kabila.
Kasi kung kunyari wala,
malas mo.
Makuwawa ka
naman.
Ito sa particular patient who unfortunately happened to have both. What happened there?
Well, fortunately, the other eye, hindi ganun kalaki yung retinal detachment. Mas iba yung ginawa naming management. So,
and was it sabay?
A few weeks apart. So, by the time na gagawin namin yung isa, pawala na yung hangin dun sa isang
and basically,
mata.
meron na siyang vision that
may konti na, tapos
na.
Akala niya okay na, tapos biglang yung isang mata naman nag-detach. Malas lang talaga. No? So,
okay. Kasi syempre parang sometimes, alam mo naman mga pasyente, like tayo kahit doctors tayo, we can be patients also, no? And not only with this kind of condition. Syempre minsan, even way mo minsan yung teka muna, parang ayoko yata mag-undergo nun. Yung mga fears So, I'm sure at least this can address sa mga fear ng mga pasyente.
What I always tell my patients, kasi sabihin nila, ito may detachment. Yung isa naman nakakakita so hindi ko na lang gagalawin. Sabi ko, I always tell them, paano kung magka-detachment yung kabila? Diba? So ayusin mo na yung maayos mo. Kasi nga, may risk ka din for detachment on the other eye.
I see. And ano mo yung mga risk, na yung talagang pwede talagang ikatakot nila to undergo this procedure.
And what risk of the surgery?
Yeah, the risk.
Of course, any eye surgery, there's always a risk of infection, bleeding, progression of cataract, no? Hindi mag-reattach yung retina. Meron talagang ganon. But palagi kong sinasabi sa patients ko who have retinal detachment, ang pagpapa-opera ng retinal detachment, para kang tumataya sa loto. Kung hindi ka tumaya, wala kang pag-asa. Wala kang pag-asa manalo.
Chance of winning,
Pero pag tumaya ka, maring manalo. Malaki yung chance manalo, pero may chance din matalo. So, that's how it is. If you do not go into the surgery, it will not get better on its own.
But in contrast dun sa pagpanalo sa loto, wala kang mawawalang malaking halaga. Here, pwede kang maging blind.
Yes.
So wala
kasi
kang choice talaga.
Ang detachment, pag lumaki na lumaki, magbablind ka talaga.
So sige, siguro sana, this preventable na lang. Can this be prevented, yung retinal detachment?
No. Unfortunately, technically, it is not preventable. What we can do is, if you have risk factors such as severe nearsightedness, patingin kayo. Kasi nakikita na namin kung may manipis sa retina. Pwede ka mag-preventive measure na ile-laser namin kung may maliliit na butas na hindi pa naman napupunit. Wini-welding namin yun. Kasi minsan yung maliliit na butas na yun yung lumalaki at nagiging punit at nagiging retinal detachment.
But when do you say that nearsightedness is severe already?
Nearsightedness, what we call high myopia is more than 600. no?
Okay, kasi tinanong ko kasi nearsighted ako, Doc. Pero parang 50 lang naman.
Hindi naman. But again, if you're, basta it's a good idea to have a regular eye checkup.
I see. So, okay. So, I'm far from, yung severe pa, di ba?
Oo.
But ito, having mentioned that, kailan, what is the ideal, okay, how do I say that? How regular should one visit their ophthalmologist for, kahit na wellness checkup for their eyes?
Ako, I always tell my patients, annually is fine.
Annually.
No? Annually talaga.
Beginning what age, sorry?
Usually after the age of 40 kasi kinakailangan na mag-reading glasses, etc. So mas may impetus na sila magpatingin ng
So kami mga 41 dapat nagpupunta na sa
nagpapatingin na kayo kasi nagbabago na yung grado nyo, no? Tapos or if you have other risk factors, then do it earlier.
And syempre siguro the younger ones na talagang meron ng diagnosis of any eye condition. Yeah. Okay, so what happens if the patient gets daw another detached retina? Does it happen the second time around?
There is a risk of a redetachment. No, there's a small chance of redetachment. Kahit maganda yung surgery mo, minsan nagkakaroon pa rin ng redetachment. Hindi na ganun kataas. But of course, the more detachments you have, the poorer the results are. Papangit lang na papangit.
It gets poorer and poorer. Yeah. But usually, if it happens, okay, so usually after, how long? How long after the previous surgery?
It depends, no? Minsan din kasi hindi rin dumidikit yung retina after the first surgery. Parang failed surgery din naman yun. Minsan nakakapeklat.
But syempre, it's not the technical, the technical procedure, the technicalities. Basically, siguro factor din ba katulad ng ibang surgical operation, yung kanilang healing process sa katawan,
one of the leading causes of failure, long-term failure of retinal detachment surgery is yung tinatawag namin PVR, or proliferative vitreoretinopathy. In other words, nagpepeklat. No? So, nagpepeklat siya, yung inoperahan mo nagpepeklat, humihila na naman siya. And that can happen anywhere from 6 months onwards. No? So
it really varies?
It really varies. Pero, yun nga, maraming iba-ibang klaseng risk factors for that. The way you heal, that like what you said, no? Some people talaga very active yung kanilang parang, for lack of a better term, yung keloid former, yung pangit sila mag-scar.
Pangit mag-scar. Kasi kahit sa balat, merong malalim mag-scar. Ibig sabihin, under yung healing, no?
Parang there's something with their healing. So, nagpepeklat talaga.
May genetic kasi, di ba, components sa healing process ng isang tao. Especially that, like for example, can diabetes also be, di ba, one of the causes also of retinal detachment? And we know that diabetic individuals have poor wound healing process.
The problem naman with diabetes is that by the time na nagka-detachment sila, ibig sabihin pangit na talaga yung yung retina nila. Panay peklat na yun. At mas mahirap ayusin yun.
So, I remember in one of our past episodes, kasi you're susuki na nga dito, Doc, diba? One of our topics was diabetic retinopathy. And you've been reiterating, no, na para lang maprotektahan yung retina, kailangan maayos lagi yung sugar. Okay, so kaya talaga lifestyle really, good lifestyle habits really is very important.
Tsaka check up talaga. Kung may maramdaman ka, magpatingin ka na.
Maganda na yung takot kayo, may healthy dose of fear. Okay na yung medyo paranoid ka, napapraning ka, rather than feeling mo complacent, okay I'm good, ganyan. Okay, nako, Doc, as usual, ang dami na namang natutunan sa inyo. And ano yung mga pwedeng advice na ibigay sa ating mga viewers, at least in lowering the risk of retinal detachment?
Well, again, if you have the risks for retinal detachment like severe nearsightedness, history of trauma, or even diabetes, magpatingin na po kayo sa doktor nyo. Hindi po walang mawawala sa atin kung magpa-regular check-up tayo sa ating mga ophthalmologist po.
Okay, and Doc, baka meron kang gustong batiin and you might want to invite our viewers to visit you here at Makati Medical Center.
Sa akin lang, magpatingin po kayo sa mata kahit sino pong doktor, basta kayo natitingnan. Yun po ang pinaka-importante.
Very simple but very important. Okay, and this time around, Doc, mention natin yung ating yung website ng Makati Med. Okay.
So, just visit the website of Makati Med at www.makatimed.net.ph. All the information regarding doctors and services of Makati Med is there at the website.
Okay, thank you once again, the very excellent Dr. Sherman Valero, an ophthalmologist from Makati Medical Center. Looking forward to seeing you here again in another episode. Okay, we hope makasambayan. Marami po kayong natutunan sa mga naging paliwanag ng ating panauhin na si Dr. Sherman Valero. Maaring ito po ay paulit-ulit namin ipinapaalala na ang mga tinatalakay natin dito sa ating programa ay magsilbing guide sa inyo to embrace a healthy lifestyle. Prioritize your health over hectic agenda. Give yourself a proactive care because your health is unquestionably valuable. And with that, para po sa iba pang mga tips o impormasyon mga kasambahay, ibabahagi namin yan. Sa pagbabalik po yan ng Doctors on TV. Nagbabalik po ang Doctors on TV. Madalas bang sumasakit ang ulo ng inyong mga anak kasabay ng pagsakit rin ng kanilang mga mata? Bakit nga ba nararanasan ito ng mga bata? Let's talk about it on Baby Talk.
Magandang araw mga kasangbahay, I'm Dr. Katrina Florcus Dacanay, your pediatrician for today. Ang isang bata ay pwedeng magkaroon ng astigmatism sa isa or parehong mga mata. Ito ay karaniwan sa mga sanggol at kadalasang nawawala ng kusa. Narito ang ilang mga tips na dapat sundin nating mga magulang kapag may astigmatism ang ating mga anak. So let's start our discussion now. Ang astigmatism ay isang kondisyon sa mga mata kung saan may problema sa refraction at naaapektuhan kung paano pumapasok ang light sa mga mata. Ito ay nangyayari kapag may abnormality sa curvature, sa cornea or lens ng mga mata. Hindi nakakapasok ng maayos ang ilaw sa mga mata na nagreresulta sa paglabo ng paningin. Ang astigmatism ay pwedeng mamana mula sa mga magulang. Kapag ang bata ay may nearsightedness or farsightedness, pwede ring magkaroon ng astigmatism. Nakita din nila sa pag-aaral na ang paninigarilyo ng ina habang siya ay buntis ay pwedeng magdulot ng astigmatism sa bata. Mahirap malaman agad kung may astigmatism ang bata dahil sila ay hindi kadalasan nagsasabi na may problema na pala sila sa kanilang mga mata. Ito ang ilang signs na posibleng may astigmatism ang inyong anak. Una, sensitive sila sa ilaw. Siya ay nahihirapan kapag tumitingin sa ilaw at nahihirapan ding mag-focus. Squinting o kaya ang pagsara or pag-cover ng isang mata tuwing siya ay nagbabasa o nanonood ng TV. Ang palalas na pagkusot ng mata ay maaaring sign na pagod ang mata ng bata dahil sa astigmatism. Ang batang may astigmatism ay pwedeng nagbabasa na masyadong malapit yung cellphone, tablet or libro sa kanyang muka. Ang mga batang may astigmatism ay ipinapakonsulta sa isang ophthalmologist or eye doctor upang malaman ang angkop na treatment. Maaring mag-recommend ang inyong eye doctor ng eyeglasses para makorek ang astigmatism. May mga cases na kailangan ng refractive surgery para makorek ang shape ng mga mata. Bigyan din ang bata ng mga pagkain na mayaman sa vitamin A, C at D tulad ng eggs, milk, green leafy vegetables at fruits. Mga mommies, kung inyong anak ay may astigmatism, siguraduhin na naisusot niya ang kanyang salamin. Ipa-check up siya regularly sa eye doctor. Bawasan din ang paggamit ng cellphone, tablets at gadgets. Encourage exercise at ang paglalaro sa labas. And of course, sundin ang payo ng doktor tungkol sa eye exercises. And that's it mga kasangbahay. I hope marami kayong natutunan sa araw na ito. As always, please consult your pediatrician for your baby's health. Thank you again for watching today's episode. Again, I'm Dr. Katrina Florcus Dacanay. You can reach me through my Facebook page, Dr. Katrina Flor Cruz, YouTube channel, Dr. Katrina Flor Cruz, and Instagram and TikTok, katrinamd.ph. See you everyone in our next episode.
Ngayon naman kasambahay, ilang impormasyon pa ang aming ibabahagi sa inyo. May pagkakataon ba na parang humahapdi ang inyong mga mata o kaya napapansin niyo ba na nagiging sensitive po ito sa ilaw? Bakit kaya natin ito nararanasan? Para po sa mga detalye, panoorin po natin ito.
Good morning mga kasangbahay! I'm Dr. Kevin Gabriel Tan and today mag-share ako sa inyo ng ilang tips how to have a good eyesight naturally. Activities that we should avoid to keep our eyes in good condition. So number 1, limit our screen time to 1 to 2 hours a day kung maaari. Kung hindi po kaya, i-practice po natin yung 20-20-20 rule. Meaning, for every 20-minute use of your eyes, magpahinga po tayo ng 20 seconds looking at a 20 feet distance. So, in short, for every 20-minute use of our eyes sa sa screens or sa gadgets, no, magpahinga po, tumingin lang po tayo ng malayo ng 20 seconds. No, ilimit din po natin, especially ngayon malakas ang araw, mainit po. Hanggat maaari po ay tayo ay magsuot ng sunglasses kapag tayo lumalabas ng bahay, lalo na sa tanghaling tapat. No, kung maaari, iwasan din natin yung masyadong babad sa init, lalo yung bata nagsuswimming ngayon, wag po sa tanghaling tapat. Mas maganda po yung mga 4 to 5 p.m. na. Tapos yung mga bata pong nasa online classes, no, masyadong maraming homeworks, bantayan po natin sila, yung pagkakamot ng mata, hindi po maganda yon kasi nakakapag-cause po yun ng astigmatism. Also, yung sa mga smokers po dyan, mga hindi magsigarilyo, hindi po siya advisable dahil ang sigarilyo, ang nikotina nito ay nakaka-apekto sa retina ng mata, nakakapaglabo rin po ng mata. And also, lastly, lahat po tayo ay very busy, pero don't forget to sleep early kasi at least 6 to 8 hours of sleep in a day will promote healthy eyesight. And foods to eat po, ano yung mga kinakaing masustansya para sa mata? Siyempre, number 1, yung carrots. No? Talagang naririnig natin to sa ating mga magulang, sa ating mga lola. Tama po, ang carrots ay mataas sa beta-carotene na nakakapagpalakas ng mata. Also, yung mga madahon na gulay, yung mga green leafy vegetables, is also very important. No? Sa mga isda, mas maganda po sana yung mga seafood, yung mga huli sa dagat, yung mga salmon, talaga yung mga tuna, pero medyo kamahalan, pero mas practical po, any isda is okay lang. Sa mga meat, okay po ang lean meat, no? Wala masyadong taba. Mga beans, nuts, itlog. Actually, yung itlog, yung yolk niya, very rich in good cholesterol that can promote healthy eyesight. Also, hindi naman lahat mahilig dito yung bell pepper. Actually, it's a very high source of beta-carotene and vitamin C, which is good for the eyes. So, bago po tayo magtapos, no, I'll leave you with this quote: "An ounce of prevention is worth a pound of cure." Sana ay nakatulong sa inyo ang mga simple tips na aking binahagi. Don't forget to follow me on my social media account, Kevin Cotan MD, at Instagram. And for more natural tips, stay tuned because natural is beautiful. Only here at Naturally Yours.
And this is to remind you mga kasambahay na bukas po ay ang National Allergy Day. Ito ay ginugunita taon-taon at idineklara noong taong 2007. Dahil sa iba't ibang klase ng atake ng allergy na maaaring makasama o mag-worsen sa kalusugan ng tao, minarapat ng ating pamahalaan na mabigyan palalo at maipaalala sa lahat ng tao sa bansa kung ano-ano nga ba ang mga impormasyong dapat nating malaman ukol sa allergy. Naku, dahil minsan nga po, ang mga simpleng ataking ito ay maaaring mauwi sa seryosong kalagayan. Naku, kaya dapat po ay wag po itong binabaliwala. And with that, mga kasambahay, we conclude our today's enlightening episode. At ang lagi po naming dasal sa lahat ng mga may pinagdaraanan, lalo na po sa kanilang mga kalusugan. May God bring healing and guidance to each one of you, mga kasambahay. Always remember, early detection saves lives. Make your health a priority. But before we end, take a moment to watch this.
Watch these snippets for the upcoming episode on Sunday.
Okay, herpes simplex virus is a human DNA viral pathogen. So pag sinabi nating pathogen, mga mikrobyo o kahit na anong bagay na magiging sanhi ng impeksyon or sakit na nakakahawa.
At yan po mga kasambahay ang aabangan natin sa susunod na linggo. And as we conclude today's episode, we want to express our heartfelt gratitude to all our viewers for their steadfast support. Your continued dedication to our show has been the driving force behind our success, and we are deeply grateful for it. We hope to continue earning your trust and loyalty. Thank you from the bottom of our hearts. And I would like to greet Kuya Daniel Razon na wala pong sawang sumusuporta sa mga adhikaing serbisyo publiko. At syempre, BMPI's General Manager, Mr. J. Eusebio. May God always protect you both and grant you a healthy life. Syempre, binabati rin natin si VP Nolly, VP Bong, VP Joseph, VP Jerry, the Doctors on TV production team, Public Service Department, and KDR Group of Companies. And also, hi sa kambal ko kay Iyo Iya, kay EJ also, kay Doc Alamin, and syempre yung mga pasyente natin sa Barba-Cabodil Health and Wellness Center. And also, hi sa mga nasa Delicates Food Corporation. And nanay and tatay, I love and miss you both very much. At sa ating mga kasambahay, naku, maraming salamat po sa patuloy ninyong pagtangkilik sa Doctors on TV. And please like and follow my Facebook page. Just type on Facebook search box, Dr. Sarah Barba-Cabodil. We hope you found this discussion informative, empowering, and inspiring. Remember to follow us on social media for updates, and don't forget to tune in next time, God willing. Muli po, magandang umaga at maraming salamat sa inyong lahat. Ito po si Dr. Sarah Barba-Cabodil. Let's make it a habit to learn about good health, only here at Doctors on TV.
We would like to thank Makati Medical Center, a hospital with a heart. Located at Amarsal Street, Legazpi Village, Makati City. You may contact them at 632-8888-8999. Like and follow their Facebook page at I Am Makati Med, or you can visit their website at www.makatimed.net.ph. Makati Med Wellness Center, located at 7th floor, Ayala North Exchange Tower 1, Legazpi Village, Makati City. We would like to thank Adlaon Optical, located at ground floor Super 8 Warehouse Poblacion, Bariwag, Bulacan, 0922-878-5911, and second floor Aliw Complex, MacArthur Highway, Calvario, Maiiwasan City, Bulacan, 0922-861-2095. Lindison Gas Corporation, located at 179 National Road, Landayan, San Pedro, Laguna, 4023. For inquiries, you may contact them at 02-8824-0867 or 02-824-9360, or you can email them at lgsalesco@gmail.com. Clinica Figura, located at Entrata Building, Philinvest, Alabang. You may contact them at 0917-317-7272. Barba-Cabodil Health and Wellness Center, located at Unit 1531, Centurion Medical Makati, Century City, Makati. You may contact them at 0917-317-7272 for appointments and other inquiries about your health and wellness needs. Dr. Sarah Barba-Cabodil would like to express her gratitude to Medical Depot, healthy num-num food. Where we go.